And just to remind everybody why we're here today, the reason we want to meet with all employees, and we've got a really strong showing of employees joining the call today from all departments, mainly because we want to make sure that you are safe and that your health and safety is very important to all of us. We also want to talk about why your health and safety is important. You provide a critical role to our community. The services that you provide are important to this community. And the better that we can adhere to the safety and health protocols with COVID, the better we can adhere to the guidelines, the better we're able to provide those services to the community. And we do not want to be in any way putting any potential for any service that we're providing today at risk. So that's the reason we wanted to talk today. We have a number of folks that are going to be talking with you. Adam London from the Health Department, Amy Ralston from the Department of Human Services, Brian Hartle from our Health Department, Al Jano and Mary Beth Van Til from Administration. All of them are going to be talking today. So thank you so much for joining, and I will turn it over to Adam London, our Administrative Health Officer, who will talk with you and tell you what's happening with COVID and give you some good information. Thanks, Adam.
Thank you, Eamon. And thanks to all of you for tuning in this afternoon. This has been a difficult year, I know, for many of you and for all of us. I hope and I pray that you and your families are doing well during this difficult year. I remember back to January and February, hearing of the reports of COVID-19 around the world and seeing what those numbers were doing day over day and the rapid increase of those numbers, and realizing, like all of us realized back in those days, that there was nothing that we could really do to stop that from coming here. And we needed to mobilize quickly in order to best understand this threat to public health and to respond in a way that was going to protect as many as possible. So from a public health perspective, whenever we're confronted with an infectious disease like this, there is what we call a chain of infection. 6 questions that we ask ourselves in order to really size up our opponent and to try to find its weak spots, try to find the areas that we can make a difference in breaking transmission and protecting lives. Walk through these 6 steps real quickly so you have a better understanding of the things that we look for in an infectious disease and what we've been trying to do related to COVID-19. The first question we ask is, what is causing the illness? What is the causative agent? You know, for some things, if it's a skin infection or an ear infection, there are different things that we can prescribe to deal with that. Maybe it's a topical cream, maybe it's an antibiotic, things that go directly to stopping that causative agent. In this particular case, the causative agent is a coronavirus. It's a virus, antibiotics, things like that are not effective against this. It's a coronavirus that, no, there are other types of coronavirus that have been with us for a long time that present themselves as a kind of a common cold. There are a couple more severe types of coronavirus, SARS and MERS, which we've dealt with in the past 20 years. This new novel virus, which is called SARS-CoV-2, is more contagious and it's more difficult to handle than those other previous coronaviruses have been. But recognizing that this is a virus is the first step in realizing that we don't have many pharmaceutical tools to address it. The second question is, where does it live in its natural state? Call it its reservoir. Where does it normally live? If, for instance, it was panda bears, well, we could tell people avoid panda bears. If it were mosquitoes, we could tell people to wear repellent and to avoid mosquitoes, or we could spray for mosquitoes. In this case, the most likely reservoir for this coronavirus began with probably bats in caves in Central Asia. Since then, however, it has made its reservoir effectively in humans. And so there really isn't anything that we can do to limit our exposure to humans in that sense. in the same way we would with mosquitoes or other reservoirs. The third question we ask is, how does it get out of that reservoir? How does it get out of a person? With other types of viruses, some are bloodborne, some are transmitted sexually. There are a number of ways that a virus can spread. In the case of this coronavirus, it's largely through saliva, and droplets of saliva, the aerosols that we exhale, these particles of moisture carry virus with them. And this is the first opportunity in this chain of infection for us to make a dent, because we can use these things. We can use masks, facial coverings, in order to arrest some of the moisture that's leaving the body containing virus particles. We can also cover coughs. We can do the things in order to prevent moisture from getting out of our body and into the air that others breathe. And while masks aren't perfect, we know that, they are effective as a risk reduction strategy, similar to wearing a seatbelt. Seatbelts don't prevent 100% of injuries and death, but they do reduce risk. And the same thing is true with facial coverings like masks. The fourth thing that we ask is, what's the mode of transmission? How does this virus move in the environment to go from one person to the next? What we know here is that it's largely airborne. It's also in those droplets of moisture that settle on surfaces in the environment, get picked up by people's hands, they go to their face. But being in the air atmosphere is where the virus is spreading. This is why isolation of sick individuals, quarantine of exposed people is important in order to reduce the amount of virus that's being pushed into the air that we share. Social distancing, sanitation of surfaces, trying to be outdoors when we have gatherings, all important in order to reduce the amount of virus in that air, that mode of transmission. That's why the number of air exchanges in a building is important as well. The fifth question we ask is, how does it get into the next person? And here we're looking at inhalation as being the primary route of intake, along with that hand-to-face contact. And here again, we're talking about masks. So we've been saying for a while now that masks are important for protecting others. That if an infected person is wearing a mask, they're less likely to be pushing a lot of virus into the air. However, what we've learned recently is that masks, while they're beneficial for protecting others, they're also protective of your own health because they limit the amount of moisture from others that you're inhaling and bringing into your own system. And then that sixth question is host susceptibility. So whenever a virus infects a person, the clock starts ticking. And that virus, its time is limited. Either the person's immune system is going to figure that virus out like a Rubik's Cube, give enough time, the immune system will figure that virus out and will take care of it. Or that person could die, of course. But either of those things are dead-end routes for that virus. It has to find another vulnerable host to move into. That's how viruses work. And so here, in order to address the vulnerability of hosts, and we know that most people are still vulnerable to COVID-19. Most of us have not been infected by this. We're still all very vulnerable for the most part. To get to a spot where we have fewer vulnerable hosts, our endgame strategy is what we call herd immunity, which is making sure that enough of our population is immune to this so the virus has a hard time finding new hosts to move into so that it can't replicate itself any further. There's a couple different ways we can get to herd immunity. One is just the natural route where over time we're all exposed to this and we all either figure out a way to take care of it through our immune systems or many of us would die. And based on the numbers that we've seen, the survivability numbers in Kent County, if we went that route, just the natural route of herd immunization, we would have probably 4,000 or more deaths in the county. The other way to get to herd immunity is, of course, through vaccine. And that's where we're really looking forward to getting vaccine in the coming months so we can go on the offensive and really take the battle back to this virus. In addition to planning for receiving a vaccine and doing that, we've had a three-pronged strategy to deal with COVID-19 this year. The first one is communication and making sure that we're pushing out lots of good information to the community on an ongoing basis about what they can do to protect themselves. We're also looking at working with the schools, with employers, with churches, with so many institutions in our community so they can prepare themselves by making their environments as low risk as possible. The second prong is testing. The sooner we can find cases, the better we can isolate them, the better we can inform people of their status so they can protect those around them. And I'm really proud of the work that our team has done and the other providers here in Kent County have done. Right now we're testing, and throughout the summer, we've been testing more per capita than any other county in the state of Michigan. That testing availability and accessibility has been really important for doing that testing, identifying where infection exists. And the third prong is case investigation and contact tracing. We have Brian Hartle here who's going to talk to that a little bit more later. But this is the other really important part of this, is getting in contact with those cases soon so they have the information they need to know in order to protect those around them, and also finding out who they've been in close contact with recently so those people can watch their own health and they can limit their exposure to other people so we can make it difficult for this virus to find new susceptible hosts. So through it all, how are we doing? So in order to answer that, I want to go to our dashboard, which you have up in front of you. This is available for all of you to see at accesskent.com in our COVID resources page. You'll see this is page 1 of that dashboard. I'm not going to go through every different metric on this dashboard, but a few that I think are interesting. On the left, we have our summary of information from Kent County. On the right is the state of Michigan overall. You'll see that right now we're at 12,000. Actually, this is through Saturday. So we'll have new information today at about 3:30. Through Saturday, we're at 12,799 total cases of COVID during the duration of this pandemic. On Saturday, we had 326 new cases reported to us. That's actually the single highest day that we've had so far. On Friday, the day before, I think we had 224 cases. Before that, we were seeing about 150 cases. So yes, our cases are growing significantly right now, and I'll show you more about that in a moment. We're at 176 deaths. We had no new ones reported to us on Saturday. This 176 is terrible. It's awful. Our hearts break for those families. However, our actual case mortality rate here in Kent County has been much less than the state overall. Right now, of all the total cases that have been diagnosed through testing, only about 1.4% of those have died. Statewide, there have been 7,182 deaths, and that's about 4.5% of all the cases statewide. So here locally, we're doing a pretty good job of getting cases to a successful outcome. And then down on the bottom, I want to point out that age group, those blue bars down near the bottom left. These are the number of cases for every decade of life. And so you'll see that the tallest bar is in our 20 to 29-year-old age bracket. And that's what we saw through most of the summer and certainly into the early fall when the universities opened. We saw lots of 20-somethings, especially in the early 20s, being tested positive. However, what's concerning to us now is that in the past month, we have seen the increase really spill into those other age brackets as well. In fact, last month, in the entire month of September, we only had 21 people aged 80 or older diagnosed with COVID-19. So far through October, and we're only 3.5 weeks into it, we've had something like 130 80 or older persons diagnosed with this. That's very concerning to us because we know that those older persons in our community are more likely to have significant serious consequences. So if we can move forward to page 2, there are a couple of graphs on the right I want to mention briefly. The one on the bottom is our new confirmed cases by date. You'll see we had that first wave back in early May. We had a bit of a ripple in the middle of the summer. And then in August and September, things kind of cooled down. We saw about 35 to 50 new cases per day on average. Those were numbers that our case investigators could easily handle. They're numbers that our hospitals could easily handle. But with the beginning of October, you see that our numbers have increased pretty dramatically. And now I believe we're about 193 new cases per day as a rolling average. So that's concerning to us because we really don't know where this is going to top off. Not having seen this virus before, we don't know what it's capable of in the fall conditions and with all of the fatigue that people have about COVID prevention. On the top, you see a graph that shows our deaths by date. We had quite a significant number of deaths back in May and June. The peak was really in June, about 3 to 4 weeks after our first wave in new cases. And then things again calmed down during the summertime. That's for a variety of reasons. I think our healthcare professionals have got some new tools and techniques to deal with this, but they're very concerned right now about being overwhelmed. And you see that our death rate is starting to increase a bit now. For most of the summer, we were seeing 1 death every 3 to 4 days. Now we're seeing about 1 death every day. And that's concerning because we don't know how high that could go as cases increase and hospitals are really overwhelmed. Let's go to the next slide, please. Okay, so this one is all about the importance of those employee health screenings that you do. And this page captures the number of screenings that happen every day throughout the participating employers, including Kent County. That's what those blue bars are. They're showing how many persons screened themselves using the tool that we created. The line, the dark blue line at the bottom, shows what percentage of those screenings were people who were excluded from work that day because they showed up with symptoms of COVID or they had a temperature when they arrived at work. And down near the bottom right, you'll see a total of fails, 2,370, and that's through a couple of weeks ago. So up until a couple of weeks ago, we had almost 2,400 people at participating employers who failed the screening and were sent home, and in most cases got tested. And while not all of those 2,400 people had COVID, a lot of them did, and that represents that this screening program is effective in identifying some people who are coming to work with those symptoms and preventing small numbers of cases from erupting into larger outbreaks in the workplace. And so that's very positive for us that we've been able to do that. We also know that just by having that screening in place, a lot of people who woke up with a fever or with symptoms don't even bother to come to work because they know they're going to be screened at the door. If we can move to page 6 in the dashboard, and this is the last one I'm going to show on the dashboard. And again, I encourage everyone to take a look at the dashboard. There really is a ton of great data here. And Sonda, if we could isolate the Kent County data by clicking on Kent at the top. Thank you. I want to go to the positivity rate on the bottom right here. This represents the percentage of tests that are done every day that are found to be positive for COVID-19. You see that, again, through most of the summer, our positivity rate was fairly low. For most of the summer, it was at about 2% of all tests that are done in Kent County coming back positive. In the last month, it has steadily increased, and now we're at a 7-day rolling average of 6.4%. So that's concerning. That's indicative that we're having community-wide transmission and that it's not confined just to one part of our community. On the top, you see a very ragged line that is our test administered. This shows how many tests are being done here in Kent County. And again, we're doing a tremendous job with our healthcare partners in making tests accessible in the community. We've been averaging between 2,000 and 3,000 tests per day in Kent. And so that's been fairly consistent going back to mid-July. So this increase in cases and tests is happening despite the number of tests being done remaining largely the same throughout this period of time. So again, I encourage you to go to accesskent.com and check out our dashboard and keep an eye on that. I want to thank everyone throughout all of your departments for all that you have done so far to make an impact, to make it difficult for this virus to spread. Kent County, I think, has risen to the occasion and has done a tremendous job in keeping our service departments and all that we do available. This is very important to us because much of the work that you all do is essential. And we need to do what we can to keep these services available in order to keep the quality of life where it needs to be here in Kent County. And more important, all of you are priceless, and we need to do what we can to keep everyone safe and avoiding this illness throughout this pandemic. So continuing services and protecting staff are priorities that we have. And to that end, we do have a safety plan that has been created to make our work and our workplaces as low risk as possible. And I'm going to turn it over to Amy Rolston now, who's going to walk us through that plan. Amy?
Thanks, Adam. Good afternoon, everyone. I'm Amy Rolston, the county's HR director, and I'm going to just run you through a couple of the more substantive elements of the county's COVID-19 preparedness and response plan, which from now on I'm just going to refer to as the plan for short. I did want to mention at the onset that this plan is co-authored and also co-administered by myself and also two other people who are on the call today. The second person is MB Van Til. MB is the person who was responsible for the administration of that pre-work COVID screen that we're all doing if we're working on site or if we're working in the field. Also, Al Jano, who is our facilities director, is on the call as well. Al is responsible for all things facilities related to the plan, including making sure that the county's various offices and departments are properly cleaned and sanitized, making sure that PPE is available as needed, making sure that physical barriers like sneeze guards and signage and all of those elements of the plan are in place and working properly. So the three of us will each have some role in the overview of the plan, but I'm going to kick things off. Next slide, please. Okay. The thing that I thought was probably the most important thing that's in the county's plan to communicate at this point is the employee assistance plan. We were, what, 7 or so months into this COVID crisis, and it doesn't look like there's a quick end in sight. So I think that for me, the most important message that I'd like to send to the county's workforce is this has been tremendously difficult for, I think, all county employees, both personally and professionally, and it has added an element of stress into our work and personal lives that has been enduring and is going to continue on for a while to come. So please do what you have to do to take care of yourself and your family. One resource that I did want to remind you of is our employee assistance plan, which is offered through Encompass, and the information is listed here for taking advantage of the benefits offered under that plan. It's free, it's confidential, it's available to anybody in your household. We are also working in HR with our L&D function and also on the Wellness Committee to identify and to offer up to the workforce other types of interventions and programs to help to maintain resilience during this difficult time. Next slide, please. Okay. So next, I'm going to move into some of the more nuts and bolts parts of the plan as it pertains to protocols that are in place to keep us all safe and healthy. Not unsurprisingly, some of the information that Adam London just shared about the COVID rates of infection in the community, we are starting to see a similar kind of effect here in Kent County. So within our workforce, so far over the course of October, we've seen 10 employees test positive for COVID. And before that, I think for any month to date, the highest we've seen was 6. We had, I think, 1 or 2 months with 5, but But we are seeing kind of unprecedented levels of COVID infection as well here in the workforce. So I wanted to just reinforce to everybody the importance of keeping all of the good practices that you have been maintaining up, and we'll go over a couple of those now. The first is, and this isn't new to anybody, most of this isn't, it's just helpful reminders. So if you're not feeling well, please don't come to work. Please stay home, notify your supervisor, and particularly if you are experiencing symptoms that are new or unusual to you that are consistent with COVID, please notify your supervisor specifically of that as well, so we can have a sense of the risk that there might be some COVID exposure if you're having that kind of a symptom. Also, if you come to work and maybe you feel fine at the beginning of your shift, but over the course of the day you start to become ill, especially if you are experiencing, again, new or unusual to you symptoms of COVID, please leave work as soon as possible. Notify your supervisor right away. Okay? MB Van Til, who is the coordinator of our pre-employment daily health screening process, is going to talk more in detail about that process, because some of the questions that are asked in that screen are going to change. So in a few minutes, she'll give more information about that. But it is a requirement for every employee who is working either on site or in the field before they start work each day to go through that health screening process. And if you answer yes to any of the questions, you're not allowed to work. So next we'll talk about mask wearing and social distancing. Employees are required to wear a mask when either working on site or in the field if they're unable to consistently maintain a 6-foot distance or greater apart from others. Also, in addition to that, employees are required to wear a mask if they're in what's called a common area. So even if there isn't anybody else around, if you're in a common area, you're still required to wear a mask. Common areas include things like hallways, entryways, bathrooms, conference rooms, break rooms, areas like that. Also, of course, you should continue to wash your hands frequently and make sure that you're taking care to sanitize high-touch surfaces. Al Jano's group in facilities also takes a huge level of responsibility in making sure that surfaces are disinfected regularly. I would defer to Al for the details, but I'm pretty sure that most common, if not all common touch surfaces are disinfected at least daily. Next slide, please. So additional workplace requirements. This first one, we have amended it a little bit due to a new state law that was that came into effect last week. So I'll tell you what the new part is when we get to it. So the first requirement here is that you have to notify your supervisor immediately if you, A, develop symptoms that are new or unusual to you, again, and those symptoms are consistent with COVID. B, if you come into close contact with a confirmed case of somebody with COVID, or, and this is the new part, if you come into close contact with somebody with symptoms of COVID. So that is being newly added to the protocol of when you would need to notify your supervisor, okay? And then the last is, obviously, if you test positive for COVID, you should also notify your supervisor right away. Okay, next we'll touch on travel. Travel is, like all of this, it has tended to kind of ebb and flow, just depending on what's going on with COVID infection rates and other things. So I wanted to just acknowledge on the front end that when you book travel, whether it's local or international, there is some risk that you are taking on, that whatever requirements or protocols are in place at the point you book the travel could possibly change when the trip occurs. So just know on the front end that there is some risk involved with travel right now in terms of requirements to isolate or quarantine that may change over time. Or even restrictions that prohibit you from traveling to a certain location, right? So what we would recommend is, due to that uncertainty, that you notify your supervisor in advance before you book the travel, so they know that there's potentially might be an issue where you may be asked to quarantine either when you arrive at a destination or when you come back home based on the travel plans that you have. Also, the CDC has implemented other types of restrictions as well, like for instance, for some types of travel that you may have to stay away from people who may be vulnerable from COVID, or vulnerable to COVID, wear a mask, and so on and so forth. So just be aware those restrictions are in place and may change over time. Also, we wanted to reinforce that non-essential business travel is still prohibited. So that would be things like seminars, conferences, training that isn't absolutely required for your job in an immediate way, those types of things. Employees should work from home when feasible. Now this one, what we have to do here at the county as it relates to work from home is strike a balance. We still have the public and they need us to provide services in an efficient and an effective way. So the way that we have applied kind of that term, is it feasible to work from home or not, is using those two filters. Can you work from home and provide exactly the same level of productivity and quantity of services that you could on site? And is the customer service experience not diminished? So that is a set of criteria that we have delegated to each county office or department to make the determination based on the services provided and the type of work that is being performed. Next, we wanted to reinforce that the COVID preparedness and response plan and the underlying laws that are represented in that plan do require that a quote-unquote supervisor has to be on site anytime employees are on site. And that supervisor has a responsibility and a role to make sure that the COVID preparedness plan is being followed and adhered to. Now, the supervisor doesn't have to necessarily be a statutory supervisor. It could be a member of staff, and that's fine. But that person needs to be designated in writing that they are the supervisor, and they need to agree to take on that responsibility. There are a couple of things that we've changed in the plan, and the next two are representative of changes that we are making to the plan. Just we've had a few months to get some experience with it, and we've determined that these changes are needed. The first has to do with shared food. If you look at the plan as it's published today, it says shared food is prohibited. And we still believe that's the best practice to minimize risk. We believe that if you can avoid sharing food, we think that that's the lowest risk alternative. However, if a department or office feels that it is important to honor occasions and things like that by sharing food, we have put some protocols in the plan to allow sharing food in a way that at least somewhat mitigates the risk of COVID exposure. So there are two alternatives offered now. The first would be if you want to bring in individually packaged and pre-prepared food like candy bars or things like that, that is an alternative that is available. The second would be if the food is not individually packaged and kind of pre-prepared, then a single person would need to distribute all of the food, and they would need to be wearing a mask and gloves in order to minimize the risk of cross-contamination. I wanted to reinforce here that the same restrictions that I mentioned just a minute ago about congregating in shared spaces and the like, those still apply here. So if you do have a situation where people have shared food, they shouldn't be congregating in a shared space eating it. They should be going back to their office, or if they want to sit in a break room, there are a certain number of chairs that are already pre-allocated in the break room to accommodate for social distancing requirements. And if people, of course, if you are eating in the break room, you don't have to have your mask on, but we would expect that the capacity in the break room would not exceed the number of chairs that are allocated there. Another change that we are in the process of making right now is to the complaint process. So the plan today has a process if you feel like the plan isn't being followed or if you feel like your safety is at risk. So the first step of the process is not changing. The first step of the process is, and will continue to be, that you should try to work things out with your supervisor if you think that's feasible. So we would encourage you to kind of try to resolve the matter at the lowest level and see if you can get a resolution to the issue with your supervisor. If not, then we are working to put in an electronic or email-based complaint portal. If you decide that you want to take it to step 2, the complaint will go to Al Jano from Facilities, MB Van Til from Administration, and myself, who are the co-authors of and administrators of the COVID plan. So in that case, if you decide you want to do that, you certainly could do so. We expect to have that up and running sometime, hopefully by the end of this week. Okay, next slide, please. Next, I'm going to hand it off to MB Van Til, who will provide more information about changes to the COVID-19 screening process.
Great, thanks, Amy. My name is Mary Beth Van Til. I work up in the administrator's office. And for the employee symptom screening, we have been regularly referencing the CDC website to keep an updated list of symptoms for our screening process. This list comes to us from the Center for Disease Control, as well as the Council of State and Territorial Epidemiologists, and aligns with the guidance from our health department. Due to some regulations that just came out over the weekend, we will be updating this survey this week to reflect the latest changes. The first question is asking about if you have one of any of the following principal COVID symptoms, and that's the uncontrolled cough, shortness of breath, difficulty breathing, loss of taste or smell. The following slide is a much longer list of symptoms, and in this one we ask if you have at least 2 of the following symptoms that are not explained by a medical or physical condition, and you can read the list there. Our third question, and this probably has the most changes, and Amy alluded to this, it talks about if you have been in contact with somebody who has been diagnosed with COVID, or displays any of the principal symptoms. And then the third caveat, or if you have attended a large gathering where social distancing and face coverings were not practiced. In the past, it was just that first criteria, if you have been with somebody who has been diagnosed with COVID. But we are now looking at if you have contact with somebody who has the principal symptoms, which were that in question 1 with that first list, or attended this large gathering. Large is defined as if it's in an enclosed setting, a group of 10 or more, and I believe in an outdoor setting, it is either 50 or 100, but I'll wait for health department clarification on that. If you are able to answer these 3 questions with no, or the I am a healthcare worker and have mitigated the risk, you then go on to that temperature check, which is the final screening. And the threshold for temperature is 100.4. Once you've completed all of these and answered no, you can then proceed and go about your day at work. I'm going to pass things off right now over to Brian Hartle with the Health Department. Brian?
Thanks, MB. So I'm going to just kind of quickly go through what happens when someone tests positive for COVID and how we do contact tracing within the workplace. So if you test positive for COVID, expect to receive a phone call or a text message from the County Health Department. In that survey, we'll do is identify when you became symptomatic. So we're looking for your onset date of symptoms. We're also looking for, if you don't have symptoms, when you had that test that shows that you were positive. But that's an important trigger for us, both for how long you need to isolate yourself, and when we're looking at the close contacts that you've had over that time when you were potentially infectious. And so for the isolation period, we want you to isolate for 10 days from the onset of your symptoms or the date of your positive test. And then we're looking at a window of time, 48 hours prior to your onset of symptoms or 48 hours prior to your positive test date when we're looking at those close contacts. We are a little bit behind right now in our contact tracing because of our large influx of cases. So we do ask you to kind of take this isolation and quarantine of your household contacts on your own, even if you don't get a notification from the health department right away. In that contact tracing, we're going to ask you about work. If you have been in work during that infectious period, again, that's 48 hours prior to your onset of symptoms or positive test date. And kind of ask if you had any close contact with individuals during your time at work. And a close contact, as you probably have heard many times over, it's that 6 feet of distance, so within 6 feet of distance, and then upwards of 15 minutes or more. Now that 15 minutes does not have to be continuous exposure. So I think that a lot of people think that like I have to be within 6 feet of someone for 15 minutes of continuous exposure. That can be cumulative time. So if you're in close proximity with someone for 5 minutes, 3 or 4 times throughout the day, that can also count as a close contact to other individuals. So keep that in mind as well. Close contact also includes any physical contact. So touching, hugging, those types of things. Or if you knew you were in close proximity to someone when you sneeze or cough, those people could be at risk as well. Because employers don't always know close contact information of employees. They might not know their phone numbers or things like that, and how to get in close contact with it, or how we can get in contact with them. We're going to be working with HR and supervisors of the departments to identify potential close contacts at the workplace. And so we work very closely with Stephanie Hernandez and the rest of the HR department if we do get a positive case here in the county to work to say who those individuals might have been in close contact with during that infectious period. And so just understand that anyone who is identified as a close contact at the workplace will be identified in our system, and those individuals will be receiving phone calls. We're now working with the state health department's TraceForce system, so they'll be receiving a phone call from that system to monitor themselves for symptoms for upwards of 14 days from the date of that last exposure. We also ask those individuals to quarantine their close contact for that 14-day time frame from that last date of exposure. I think that kind of covers it. So we'll kind of move on from there. And if anybody has any questions, I'll put it in the chat or we can get to them later on.
Perfect. Thank you very much, Brian and Adam and MB and Amy. We are now going to move to the question and answer section of the webinar. So if all of our panelists could please turn on their cameras, and we are going to try to do these questions in rapid fire, as we've got a lot of questions that we will try to get through. Steve Kelsel from the health department will start asking the questions, and we ask that you try to keep your answers as brief as possible so we can get through as many as possible. So Steve.
All right, this one probably goes to Adam or Brian. What is KCHD's basis for deciding when to recommend that a school building be closed?
Yeah, so Steve, I can take that one. And so it's our priority that we keep schools open if possible. We have been working with the schools. When they have cases that are identified, we're looking at how many people are in quarantine, and then we have a conversation with the school. Can they effectively keep school in face-to-face with so many people in quarantine or not? There's also a matrix that we're using that we've created in partnership with other health departments, looking at risk level in the community and transmission and other factors in the school. There's a lot to it, but we do work carefully with the schools to make those decisions collaboratively.
And while we're on the subject of schools, someone asked, if someone's child is sent home from school to isolate because of exposure, should the parent continue to go to work?
Well, I can take that one. If you are a close contact with somebody who has symptoms of COVID, which most typically, if it's your child and a member of your household who would be, then you should not be working. So that would fall under that situation where you're a close contact of somebody with symptoms of COVID, assuming that the child had symptoms of COVID. If the child was sent home because the child is a close contact, but the child does not have symptoms of COVID, then we would expect the employee to continue to come back to work, and there wouldn't be any disruption to the employee's requirement to work. A close contact of a close contact is not something that warrants quarantine.
Thank you.
Sorry to interrupt the flow here, just for the attendees. If you do have a question for the panelists, if you'll please submit it through the Q&A. We unfortunately cannot answer questions through raise of hand, so please submit any questions through the Q&A portal.
Here's another question we've heard a lot over the last several months. If you've had a positive test and you are recovered, am I immune to getting the virus again?
Yes, that's a good question, and it's an open research question right now. There are very few absolutes in nature. We do believe that the vast majority of people do have immunity if they have recovered from COVID-19. We don't know how fully or for how long that immunity lasts, so it's very much an open research question. There are very few documented cases where there were actual secondary infections, so it seems as though that's rare, but can happen in some rare cases.
I'll just jump in real quick. Right now, the CDC guidance says that after you've tested positive, if you do come in contact with someone who's positive for COVID-19 within 3 months after your test of being positive, you do not need to quarantine again. So that kind of gives you some indication of a short term, like a 3-month immunity that you have.
While we're speaking of quarantine, this is a question that has come up over and over again. If I get a negative test and I'm under quarantine, can I end my quarantine early?
No, that is unfortunately doesn't get you out of quarantine early. Negative test is only indicative of what the virus is like in your system at that point in time. So it doesn't clear you for the rest of that quarantine period, because you can potentially develop symptoms at any point during that 14-hour or 14-day time frame.
Why can't employees conduct a health screening prior to coming in to work?
That would probably be either for Amy or Adam, that we're getting some questions about. Can they take it at home, or why do they need to take it here at the facility?
Or MD, would you want to field that one?
Yeah, I can field that. So we are doing this as, again, a way to mitigate the risk here at work. And we have found that where we are not adhering to the testing protocol or to the symptom screening protocol, we have seen increase in outbreaks in departments. We also have this in the external, in the business world as well too. So when we are not performing these regular tasks, when employees aren't anticipating it, we don't have the same adherence to the policy as we do when we are mitigating it when employees first arrive at work.
Yeah, it's a best practice to do it this way. No screening is perfect, but it's better to do it this way than at home.
All right, what happens with an employee who answers yes to the large gathering with no social distancing or masks on question, but doesn't have any symptoms?
Well, in the situation of an employee who has been exposed but doesn't have symptoms, we would ask that person to quarantine. In situations where Kent County is your employer, ask you to quarantine. If you haven't already used your 80 hours of leave under the Families First Coronavirus Response Act, that leave would be available for you to use to cover the quarantine period.
All right, should an office of 10 plus individuals all be in the office together given the current numbers?
I'll take that one. There isn't any legal restriction that would say that you can't have more than 10 people in an office that I'm aware of. And we have done the due diligence to, and this is more, if Al wants to speak to this, he's probably better versed at it than I am, but I know Al Jano went to every single county facility office to make sure that the appropriate protective barriers and distancing were in place to keep people safe. So Al, I don't know if you want to speak to some of that work.
You know, some of it depends on the office and what you remember what Amy already shared and MB shared about being able to work from home and still do your job. Then perhaps there's a couple people that could stay home or something. But our best in facilities anyway, what we've done is tried to create a barrier from the public, okay, and tried to space out appropriately in workstations. That can be some inconvenience to some people, like might have to move to a different workstation than they're used to in order to maintain distancing. We also do a lot of cleaning throughout each day. There's hand sanitizer everywhere. There's in common areas. Of course, we all have our masks. Yeah, you're talking to somebody that's been working nonstop. All of our facilities teams have been nonstop. Parks Department has been, clerks, treasurers, Register of Deeds, Health Department, and so it's working. In our court systems, we're limited, but things are working. People are using common sense to make sure that there's a reasonable distance between others.
I have another one here I want to get to quickly because I know we're getting a little short on time. And this is one that's going to come up with the holiday season right upon us. I have a child who's currently in college. She's following all masking guidelines and she's getting tested regularly. So far, all of the tests have been negative. When she comes home, how do we welcome her back into the house?
Yes, that's going to be a challenge, you know, for I think families throughout the U.S. We do have some guidelines from the CDC that recommend keeping family gatherings to fewer than people from 3 households and keeping them as small as possible. And so I think the answer is carefully. Making sure that people who are entering the home, that they're not demonstrating symptoms. If they have been tested, great. But then, you know, being mindful of everyone's health while they're there.
This is probably a question for Brian. When the health department is calling for tracing purposes, how will the caller ID reflect this? I've been asked by others how they will know because people typically don't answer unknown phone numbers.
That's a great question. You know, we're all of our contact tracers, or most of them, are working from home, and they've got county issued 8x8 phones that call through the internet. I don't even know the number that shows up. I believe it's a local number. However, that'd be a question I need to find out more about from Steve Lane in our IT department, is how that shows up. But we understand that, you know, people are skeptical of phone calls that they get, and now that we're doing the text messaging, where you get a link to a survey via the text messages, people are also, you know, skeptical about that with you know, phishing and all that type of thing that goes on. So we're fully aware of that, but we do our best to get the messaging out there to let people know that, you know, when you get this phone call or when you get this text message, this is kind of what it's going to look like, or this is, you know, who's going to be on the other end, and this is what they should be saying.
All right, thank you, Brian. We had another question in here. Give me half a second, I will find it. Somebody wanted to know about church gatherings, and when those numbers get above 10 people, does this mean that I should not be going to church gatherings?
So as I recall, church is not in the Director Gordon's epidemic orders. It's excluded from that, so that you know, that doesn't technically count. However, the same principles apply to church and everywhere else for the sake of limiting your risk. Just be careful. You know, wearing a mask, distancing, hygiene. If you see a crowd, avoid crowd. I think that applies wherever you're going.
Okay, we've got one more quick one here, and then we're going to put a wrap up on this. And it may be too early to talk about this, but as we all wait for the good news that a vaccine would undoubtedly bring, do we know how it will be distributed yet?
Not with exact detail. I expect that healthcare workers and frontline workers are going to be provided vaccine first because of the risk of their job. And then depending on what we learn about the virus through this phased study approach, we may learn that certain populations have different side effects than others, or that there is greater efficacy in certain populations. And that may determine where we focus our efforts. And we're also going to look at our community and who's the most vulnerable. And we're going to try to align that with accessibility as we gradually roll out vaccines. So a lot of questions still to answer with vaccine. We hope that they're answered very soon.
Thank you, Adam. Amy, we do have one more quick question for you. And can you briefly tell us how leave works if an employee has to go home for quarantine, for instance?
Sure. Yeah, anytime an employee is required to quarantine or isolate, either by Kent County as their employer, by the Kent County Health Department, or another local health department, or by their doctor, if it's for COVID-related reasons, then generally the employee is eligible, if they're full-time, for up to 80 hours of full pay in continuation of leave. The process to apply for the leave, it's administered by Morningstar, which is the same firm that administers our short-term disability benefit and FMLA. So the employee would contact Morningstar, and Morningstar would walk them through the process of applying for the leave.
Thank you, panel. In the interest of time, we unfortunately have to cut the question and answer period a little short. We do encourage all the attendees to visit accesskent.com, well, our COVID section, as well as Kent County Back to Work. There are frequently asked questions that many of your questions that did not get answered are on that website, and we will do our best to get those answered and back out. So we'll now turn it over to Amy and Wayman to talk about kind of next steps and closing remarks.
Okay, so next steps, I'll cover that. I mentioned that the process for an employee to file a complaint if they feel like their safety is at risk or the COVID plan is not being adhered to. We're working on that process right now. Our goal is to have that squared away by the end of this week. So additional information about that process, and also an updated version of the county's COVID preparedness plan with the updates that we've talked about in this meeting, and also some additional edits as well will be provided to you, if not by the end of this week, by early next week. Also, you should look forward to additional communications that highlight specific areas of the plan and other types of COVID education, including changes that seem to occur regularly in the regulatory landscape and how those things impact us. So expect those to be on the way in a pretty routine manner over the course of the next couple months. Thank you. I'm going to hand it over to Wayman.
Yes, thanks, Amy. We appreciate all of the good Q&A that occurred. Thanks, team, for putting this together. I hope everyone felt that this was a good use of your time. Hopefully you got the message out, how important your health is, your safety is. Please be vigilant. Please keep your distancing. Please make sure that you're following the guidelines. We want to make sure that we're all safe and able to do our jobs on a day-to-day basis. Thank you again, and we look forward to hearing from any of you that have additional questions. You can use the portal as Amy talked about if you have any concern that hasn't been followed by your supervisor. Thanks, everyone. Have a great day.